Hi everyone, welcome back to Medical Explorer. Today in this lecture we are going to discuss how the de-addiction of the smoking is approached. When a person is smoking for a long or chronic way, then the person is supposed to be de-addicted from the addiction by using some drugs. In this category, we will be discussing uh, first line drugs, second line drugs, the most effective treatment, and the most effective drugs use, and the off label drugs uses in this category. Basically, before going to this lecture, we need to know about some terminology. That means the name of the drugs we need to know. That can be the nicotine, penicillin, and the bupropion in the first line of drugs. In the second line of the drugs, there could be the clonidine and the nortriptyline, and the off-label use there could be the topiramate, mecamellin, and the rimonabant. So let's begin the lecture. At first, the first line of the drugs. In first line of the drugs, there are three important drugs. That is the nicotine, penicillin, and the bupropion. So it can be remembered by simple mnemonic. That is the nicotine, very bad. Nicotine, penicillin, and the bupropion. Before going to lecture, it is very important to note that the nicotine is not given in the very short path route. It is it is administered to the patient in a long term route. So why it is? Because if the patient is administered the drugs, nicotine in the sublingual or the oral way, then it will be absorbed very fast and it will be producing an amnestic response, and the patient will be feeling that it is more better than the original cigarette smoking or the any other tobacco. So it is given in it is never given in the oral and the sublingual route. So it is given in the transdermal passage, nasal spray, lozenges, and the chewing gums. These are the dosage form available of the nicotine. So remember, nicotine is never given in oral and the sublingual route. So now coming to the penicillin. So penicillin is actually the partial agonist for the nicotinic receptor. पार्शियल एगोनिस्ट मतलब क्या होता है, मतलब उसमें वो फुल रिस्पॉन्स प्रोड्यूस नहीं कर पाता है, पार्शियल रिस्पॉन्स प्रोड्यूस कर पाता है, तो वो पेशेंट उतना ज़्यादा मतलब प्लेजर भी नहीं होता है, उतना मतलब क्रेविंग भी नहीं होता है. तो एक चीज समझाता हूँ कि when a person is smoking, there is pleasure, and when the same person is not smoking, there is a feeling of the craving. तो pleasure and the craving, pleasures, craving, pleasures. So we need to break this cycle, cycle of the pleasure and the craving. So suddenly, if the person is to be wearing of this smoking, then he will be suffer from the withdrawal syndrome. Therefore, we need to reduce the doses of the drugs in a gradual manner to the baseline. So this is the basic concept. So penicillin is the partial agonist for the nicotinic receptor, but one thing is to remember that it causes depression and the suicidal thought. Now the next one is the bupropion. It is an antidepressant and it stimulates the nicotinic receptor. It's the agonist for the nicotinic receptor, but it inhibits the reuptake of the norepinephrine and the dopamine. जो भी कैटेगरी मतलब जो भी न्यूरोट्रांसमीटर मतलब प्रीसाइनेप्टिक मेम्ब्रेन से रिलीज होता है, वो मतलब कुछ टाइम के लिए साइनस में रहता है, उसके बाद पोस्ट साइनेप्टिक मेम्ब्रेन में जाके एक्शन क्रिएट करता है. तो if the neurotransmitter is not reuptake by the channel of the presynaptic membrane, then the feelings of the pleasure will be longer time. Understood? So it inhibit the reuptake of the norepinephrine and the dopamine. तो dopamine हमारा मतलब overwhelming feeling करवाता है. तो इधर the most important thing is that all these three drugs are responsible for causing of the seizure or the serious problem like hypertension and the angina. Most importantly, that the bupropion which causes the more seizure. And another important point for the penicillin is that it is used for the tobacco. All these three drugs are used for the direction of the smoking. This is the फूकता है ना उसको, but tobacco के लिए penicillin को यूज किया जाता है. This much. And another important point we can add here that the penicillin is this much only you can remember for this three drugs. Now coming to the second line drugs. तो second line drugs when the first line drugs are contraindicated, मतलब उससे कोई काम नहीं हो रहा है तो second line drugs में उसको मतलब प्रेफर कर दिया जाता है. तो second line drugs में हम क्या क्या देखते हैं, एक नंबर में देखेंगे क्लोनिडीन और दो नंबर में है नोट्रिप्टिलिन. तो क्लोनिडीन इज a drug of choice for the seizure and the serious disease patient. तो जिसका सीजर है नहीं तो सीवियर डिजीज एंजाइना और हाइपरटेंशन है उसको क्लोनिडीन प्रिस्क्राइब किया जाता है अगर उसको ड्रग एडिक्शन से मतलब स्मोकिंग एडिक्शन से छुटकारा मिलना चाहिए. Now another term is the off-label use. So what is off-label use? Off-label use is a term actually generally used for the not approved drugs but have some clinical effect, beneficial clinical effect. So in this category we have three drugs that are the topiramate, mecamylamine and the rimonabant. याद रखना टोपिरामेट एंटीबायोटिक ड्रग है. तो मेकामिलामाइन क्या होता है, it is used for the treatment of the nicotine poisoning, and the rimonabant it is an CB1 blocker, that is the cannabinoid blockers. पहले इसको मतलब एंटी ओबेस ड्रग्स के रूप में डिस्कवर किया गया था, बट लेटर इट वाज फाउंड दैट इट इज आल्सो हेल्प इन द एंटी स्मोकिंग ड्रग्स. तो बट इन फर्दर लेटर इट वाज बैन बिकॉज इट इंक्रीज द सोशल थॉट. ओके ओके नाउ कमिंग द मोस्ट इफेक्टिव ट्रीटमेंट. तो मोस्ट इफेक्टिव ट्रीटमेंट ये क्या है, कोल्ड टर्की टेक्निक. ये क्या है, तो मोस्ट इफेक्टिव ट्रीटमेंट में वो है जो मतलब मैं आज से या कल से मतलब स्मोकिंग करूंगा ही नहीं. तो इट्स द साइकोलॉजिकल थिंकिंग दैट आई एम नॉट बी स्मोकिंग फ्रॉम टुडे ऑनवर्ड्स और टुमारो. इट्स द स्ट्रॉन्ग डिटरमिनेशन बाय द इंडिविजुअल. तो दिस इज द मोस्ट इफेक्टिव ट्रीटमेंट. नाउ डोंट कंफ्यूज विद द मोस्ट इफेक्टिव ड्रग्स. तो व्हाट इज द मोस्ट इफेक्टिव ड्रग्स? देयर इज द निकोटीन ट्रांसडर्मल पैसेज, मतलब पैसेज के रूप में अगर दिया जाएगा तो वो स्लोली रिलीज करेगा और मतलब क्रेविंग और आपका क्या है प्लेजर का साइकिल को ब्रेक करेगा. ओके तो इन दिस लेक्चर दिस मस्ट ओनली ट्राई टू रिमेंबर द फर्स्ट लाइन ड्रग. दिस द मोस्ट इंपोर्टेंट, दिस द निकोटीन, penicillin and the bupropion. This is the simple meaning. This is the nicotine very bad. And in second category there is the clonidine. It is very important because it is a drug of choice for the seizure and the CBS patient suffering from hypertension and angina. So in this lecture we are limiting the points this much only. In our later lecture we will be discussing about the anticholinergic drugs.